Okay, so today's topic is on the respiratory system. So the components of the respiratory system can be divided in a few different ways. It can be classified in a few different ways. For example, anatomically, you can have the upper respiratory tract, which includes the nose, pharynx, and the larynx, and you can have the lower respiratory tract, which includes the trachea and the bronchi. And you can also classify it functionally into the conducting zone and the respiratory zone. So the conducting zone, which consists of the trachea, the bronchi, the bronchioles, and the terminal bronchioles, they conduct air into the respiratory zone. And the respiratory zone consists of the respiratory bronchioles and the alveolar sacs, which consist of alveolar ducts and the alveoli. So the respiratory zone, it participates in gas exchange. So whenever you inspire air, here you're going to have oxygen. It's going to go into the blood. And then the CO2 from the blood, right here there's venous blood. So it's deoxygenated blood, which contains a relatively high concentration of CO2, carbon dioxide. It's going to go out and you're going to expire it into the environment. So we call this gas exchange. And the respiratory zone specifically participates in gas exchange, while the conducting zone does not. Okay, so the conducting zone can be further classified into large airways and small airways. So the large airways are the nose, the pharynx, the larynx, the trachea, and the primary bronchi. In this area here, the primary bronchi, there is airway resistance is highest. So there's high resistance to airflow. And then we have the small airways, which include the bronchioles and the terminal bronchioles. So right here, the right mainstem bronchus and the left mainstem bronchus, we also call them primary bronchi. But when they divide, they become secondary bronchi. And then when those secondary bronchi divide, they become tertiary bronchi. And beyond this point, you get terminal bronchioles. And then further down, you get terminal bronchioles. So the difference between the bronchi and the terminal and the bronchioles is the absence of the cartilage. So right here, the bronchi, they're surrounded by cartilage, while the bronchioles are not surrounded by cartilage. And the airway resistance is least in the terminal bronchioles. Okay, so the function of the conducting zone, it warms, humidifies, and filters air, but it does not participate in gas exchange. So whenever the parts of the respiratory tree that don't participate in gas exchange, we call this anatomic dead space. Okay, so like I mentioned, the respiratory zone, this is where gas exchange occurs. The respiratory zone is also called the lung parenchyma, because parenchyma is the functional tissue of an organ. So the function of the respiratory system in general is gas exchange. You want to deliver oxygen to the blood and you want to get rid of CO2. So because this occurs in the respiratory zone, we call this tissue here in the respiratory zone the lung parenchyma, because it's the functional part of the respiratory system. It consists of the respiratory bronchioles, the alveolar ducts, and the alveoli. Okay, so let's talk about the anatomy of the lungs. The right lung consists of 3 lobes: superior lobe, middle lobe, and inferior lobe. There's a horizontal fissure and an oblique fissure. And then the left lung has 2 lobes, superior lobe and inferior lobe, and it's divided by an oblique fissure. You can think of the lingula right here as the middle lobe of the left lung. So relations of the pulmonary artery to the bronchi. So here we have the right ventricle, and it's going to give off the pulmonary trunk. And then the pulmonary trunk is going to divide into the right pulmonary artery and the left pulmonary artery. So the right pulmonary artery is anterior to the right primary bronchus, and the left pulmonary artery is superior to the left primary bronchi. And a good way to remember this is by the mnemonic RALS. So the right pulmonary artery is anterior, and the left pulmonary artery is superior to its bronchus. Okay, so when the trachea bifurcates, this area here where it bifurcates into the right bronchus and the left bronchus is called the carina. Whenever you aspirate something into your airways, if it hits the carina, you're going to cough very violently, and this is a very important reflex, so that when you aspirate something into your airways, you can expel it. So the carina is very sensitive to foreign objects. Okay, so anterior to the carina is the ascending aorta, and posterior to it is the descending aorta. So the carina is posterior, so it's behind the ascending aorta, and it's anterior-medial to the descending aorta, because here this line here is medial, and this would be lateral, of course. Okay, so let's talk about some clinical correlations. If a child aspirates a peanut, and by the way, what we mean by aspiration is that when someone, instead of swallowing something, so instead of something going down the esophagus, it goes into the airways, goes into the trachea and the bronchi. So let's say a child aspirates a peanut. Which lung will it go to? Okay, so anatomically, the right bronchus, it's wider, it's more vertical, and it's shorter than the left bronchus. So it's anatomically the path of least resistance. So whenever something is aspirated into the trachea, chances are this foreign body will go to the right lung. Okay, let's talk specifically where this foreign object is going to go into the right lung in different body positions. So let's say a child is upright and he aspirates a peanut. Where will it be found? It's going to be found in the right lower lobe. Okay, so let's say the child is supine, is in the supine position, and he aspirates a peanut. You will find it in the superior segment of the right lower lobe, so around this area. Let's say the child is lying on his right side and he aspirates a peanut. It's going to be found in the right upper lobe. Okay, so let's talk about the diaphragm. The diaphragm is a musculotendinous structure. It's important for breathing in general. It's important for normal, quiet breathing. It's innervated by the phrenic nerve, which picks up fibers from C3, C4, C5. You can remember the mnemonic C3, C4, C5 keeps the diaphragm alive. A few structures in the thorax and abdomen perforate it and pass through it at different vertebral levels. So here we have the vertebra. So for example, here we have T12, or the 12th thoracic vertebra, and you can see that perforating the diaphragm at this level is the aorta. So we say the aorta perforates the diaphragm at the level of T12. And now we'll talk about a few structures, a few important structures that perforate the diaphragm. Okay, so starting first at T8 in the central tendon. At the level of T8, the inferior vena cava and the right phrenic nerve pass through the diaphragm. At the level of T10, the esophagus and the vagus nerve pass through the diaphragm. And one way you can remember this is that the esophagus sometimes is spelled like this. Instead of with an E, it can be sometimes spelled with an O. And the vagus nerve is also called cranial nerve 10. So you can think of cranial nerve 10 as T10. Okay, so at the level of T12, you have the three important structures that pass the diaphragm at the level of T12, which include the aorta, the thoracic duct, and the azygous vein. So the azygous vein is right here, this vein right here, and then it dumps the blood into the superior vena cava. And the thoracic duct is the structure in green over here. It's part of the lymphatic system. It carries lymph. Okay, so they perforate the diaphragm at the level of T12. And one way to remember these structures is T12, red, white, and blue. Red for the aorta, white for the thoracic duct because lymph is white in color, and the azygous vein because it's the vein, blue. So T12, red, white, and blue. Aorta, thoracic duct, and azygous vein, the level of T12. Okay, so whenever the diaphragm is irritated, you're going to have referred pain at the trapezius ridge and the shoulder. Okay, so let's take an example. For example, let's say we have inflammation of the gallbladder. Right here, we have the gallbladder. If it's inflamed, we call this cholecystitis. The inflammation can spread to the diaphragm, right here, and this irritation of the diaphragm is going to refer this pain to the dermatomes of C3, C4, C5, and you're going to feel pain at the trapezius ridge and the shoulder. And this is because the diaphragm is also innervated by C3, C4, C5, and you have these dermatomes right here. So you will feel pain at these sites. Let's talk about phrenic nerve injury, but before we do, let's talk about how the diaphragm normally functions. So let's say here you have the diaphragm. This would be the right hemidiaphragm, and this would be the left hemidiaphragm. So the right hemidiaphragm is innervated by the right phrenic nerve, and the left hemidiaphragm is innervated by the left phrenic nerve. So whenever you inspire, the diaphragm goes down. So the diaphragm goes down, it allows your lungs to expand and fill with air. Let's say that the right phrenic nerve is injured. This part of the diaphragm is going to be paralyzed, so it can't move, while the left is normal. So the left is going to go down normally, but the right is going to stay elevated. And this is what you will see on chest X-ray whenever you have a phrenic nerve injury. Okay, so let's say there's phrenic nerve injury. You're going to, and specifically unilateral injury, so one side is injured only. You're going to get hemidiaphragmatic paralysis, so only one side is going to be paralyzed, and this will cause ipsilateral, so same side as the nerve injury, ipsilateral elevation of that hemidiaphragm on X-ray. So here we have a chest X-ray. You can clearly see that the right hemidiaphragm is elevated compared to the left. That means that the right phrenic nerve is injured, and that this diaphragm is right hemidiaphragm is paralyzed. Because if it wasn't, if it was normal, it would go down and allow the lungs to expand to fill with air, just like the left did.